Alrighty, so my clinical question is costochondritis. We discussed it in class kind of briefly. And so some common symptoms that you can see with this are like sharp stabbing pain on one side of the sternum, typically the left, but it could be either one. And often it's in between the second and the third intercostal space. And then the pain's going to worsen with a cough or with a deep breath. So it is kind of pressure dependent. And pain can radiate to arms, back, and shoulders, which I'll talk about later, can be a red flag for other symptoms like a heart attack. So it can affect any age, but typically is for people over 40 years old, and mainly women are affected. And then for an outcome scale, really the issue is just pain with costochondritis. And so you can do like a visual analog scale or whatever pain rating that you prefer. The onset can be like a macro trauma, like heart surgery or like a motor vehicle accident, or it can be a small repetitive action like lifting weights. So kind of both extremes. Some aggravating factors could be just any upper body movement. It really can be quite severe, but especially horizontal AB and adduction. And also just exertional activities can make it worse. Some people find for eases that like thoracic flexion helps the pain rest, and then a cough suppressant, because like I said kind of earlier, coughing can make it worse. There's no 24-hour pattern, so it's kind of just whenever they make those movements. For systems review systems, as y'all are probably realizing, you need to screen for cardiac issues because it is very similar to myocardial infarction or heart attack. And so you need to kind of screen that out. And if you have any worries, just refer them. Don't keep doing what you're doing. So like I said, some precautions, contraindications. If you think it is a heart attack, please stop and don't continue. When you're seeing their range of motions, like active and passive, make sure you're doing slow, controlled movements because the pain can be quite severe. Mobilizations, they're going to have hypomobile joints with costochondritis. So make sure you're being cautious and like monitoring their pain and their irritability. And then a lot of people use TENS to treat it. And so like always, just screen for those contraindications like implanted devices, cancers in the area, hemorrhage, infection, all those. So for the physical exam, actively, I kind of mentioned this earlier, so pain with like shoulder horizontal, AB and adduction. A lot of times they'll have pain with cervical flexion and contralateral rotation, so away from the side of their pain. And then thoracic extension and rotation, because again, you're kind of like putting your sternum, like you're stretching it. But also it really varies patient by patient, so it's not really a standard view for anyone. And then passive, kind of the same thing, depending on their severity and irritability. For accessory motion, you're going to see hypomobile first and second ribs normally, and then also a hypomobile unilateral posterior to anterior glides of the affected joints. So again, it could be anywhere in the sternum. So just whichever joints are affected, they'll be hypomobile, most likely. Special test. There is a special test for first rib hypomobility, which is the cervical rotation lateral flexion test. And it has an accuracy kappa of 0.84, so it's pretty accurate. Palpation, kind of like you're probably assuming, there'll be pain along the sternum. And then a lot of these people will have tight pecs, tight upper traps, and tight ipsilateral scalenes. For differential diagnoses, again, myocardial infarction, that's like the main one. Anxiety can also mimic a lot of these symptoms, and also Tichy's syndrome. And really that's very, very similar to this. The only differentiation is that with Tichy's, you'll see swelling in the sternum in that area. And with costochondritis, you will not see any swelling. For diagnostic imaging, it's really to rule out conditions. So you can do like EKG for check like cardiac arrhythmias, CT, MRI, and that will help rule out other conditions. I'm going to keep honing in signs and symptoms to refer. If you're thinking they have a heart attack, you think they have anything like that, radiating pain between the scapula, feeling like they're being crushed, breathlessness, just refer out to the emergency room. And then surgical indications, people can do injections of numbing medications, and also injections of corticosteroids can help. But this condition really can last for a long time. And so trying to figure out ways to manage their pain in physical therapy can be really helpful. Also, this condition isn't referred to physical therapy a lot, but we have been able to make progress with this. So just know you can treat it, and it might be a long duration of pain, but like we can improve it some ways. So that's costochondritis.